Y por agradecer lo extraño de simplemente ser un alma curiosa, singular, compleja en su calma y tempestad. Dime, ¿por qué será? Dime, ¿por dónde vas? Dime. Y en el amanecer, cuando todo va cambiando de color y vemos aparecer un mundo lleno de belleza y de dolor. Dime, ¿por qué será? Dime, ¿por dónde vas? Dime, ¿de dónde somos? Dime. Y dime, ¿por qué será? Dime, ¿en dónde estamos? Dime, ¿por qué? Y por pertenecer a la gente del libro, pretendiendo entender los enigmas del universo. Dime, ¿por qué será? Dime, ¿por dónde vas? Dime, ¿de dónde somos? Dime, dime, y dime, ¿por qué será? Dime, ¿en dónde estamos? Dime.
Well, good afternoon, everyone, and welcome to the second annual Health Equity Training Opportunities Showcase. My name is Kelly Bauer. I am a faculty in the School of Nursing and an associate director for the Urban Health Institute, the host for today's event. I'd like to thank our Urban Health Institute team for all their work and support in putting together this fantastic event. In particular, big thanks to Nancy Edwards-Malello, Natalie Wiggins, and Amani West. Next slide. We want to start today's program with an acknowledgement of Indigenous and racial inequities. We acknowledge that the Johns Hopkins University and our schools are on the traditional and contemporary lands of Indigenous people. Our campus is on unceded lands of the Piscataway and Susquehanna people. Today, there are more than 7,000 Indigenous peoples in Baltimore City, including members of the Piscataway, Lumbee, and Eastern Band Cherokee. We acknowledge the history of oppression and systemic inequities while representing all tribal nation sovereignty. We strive to do our own work to address the inequities and disparities that Black, Latinx, Indigenous and Native American persons, Asian Americans and Pacific Islanders, and other persons of color, members of religious minorities, LGBTQIA persons, persons with disabilities, and persons otherwise adversely affected by persistent poverty or inequality, while expanding our partnerships with and following the lead of these communities. A few housekeeping notes. First, the event is being recorded and will be shared. The live captions for today's events are auto-generated, and you'll you were able to either enable or disable them using the controls at the bottom of your Zoom. Please do use the Q&A function also found at the bottom of your Zoom window to ask questions if you'd like. And there is a thumbs up button to see the most popular questions. There's also a chat function that can be used for reflection and dialogue. We do ask that you use only the Q&A window to pose questions to the panelists. I apologize for the dog. For today's event, we are excited to bring together a number of I sincerely apologize. The excitement of presenting from home. For today's event, we're so excited to be bringing together a number of Johns Hopkins centers and departments that are leading work in health equity right here in Baltimore. You'll see them listed here on the slides. We'll hear from each presenter about the work that they do, how they partner with community, and they'll be highlighting opportunities that exist for students and trainees to get involved with the health equity work that they do. We want you to be able to be engaged, so we'll hear from the first 5 presenters, and then we'll have an open discussion with questions, opportunities for questions from the audience. Then we'll hear from the next 4 presenters, again, followed by another Q&A. And I'm now so pleased to introduce Dr. Lisa Cooper, Director of the Johns Hopkins Urban Health Institute.
So good afternoon, everyone. It's a pleasure to be with all of you here today for our 2nd annual Health Equity Trainee Showcase. As Kelly just said, I'm Dr. Lisa Cooper. I'm the director of the Urban Health Institute, and I'm also the director of the Johns Hopkins Center for Health Equity. I am really ably supported by an amazing team, and you see them listed here and shown here on this slide. Kelly mentioned Nancy Edwards-Malello. Seems like today is the day for interruptions. Nancy Edwards-Malello, Imani West, Natalie Wiggins, who are an amazing team. We have Emily Carletto, our program assistant, and then we have several associate directors, Rebecca Atnafu-Boyer, Kelly Bauer, Kendrick Gwynn, Vanya Jones, and Rachel Thornton, who helped to lead this institute. We'll move to the next slide. Natalie, I think you were going to be advancing the slides for me. Okay. So our mission at the Urban Health Institute is to advance health and health equity in Baltimore. And we do that through 3 main goals. One of them is to facilitate and recognize collaborations between communities, universities, healthcare delivery systems, government, and the private sector to build the collective capacity for achieving health equity. Our second goal, even though our slide isn't shown, Natalie, I'll wait for you to put it back up, is that we mobilize resources in support of promising strategies to achieve substantial gains in the health and well-being of Baltimore residents. Our third goal is that we advance understanding, dialogue, and trust to create pathways to health, well-being, and social justice in Baltimore. Natalie, would you please go back to the slide presentation? Thank you. So again, here's our mission with our 3 goals. And again, you'll hear much more about these goals as we move through. So we can move to the next slide. So for goal 1, as I mentioned, we facilitate collaborations between communities, universities, and healthcare delivery systems. One of the things we do is that we support community academic partnerships through health equity impact grants. So some of our upcoming dates are that the UHI Baltimore Health Equity Impact Grants, which were formerly known as small grants, are due on November 1st. So we currently have a request for proposals out, and we will have a Q&A session for those who are interested in applying on September 29th. The other important date that we have coming up is that we are going to be conducting a series of community capacity building workshops, one on grant writing for CBOs, a second one on an introduction to financial management, and the third one on community program evaluation. So look out for those dates. The grant writing workshop is on October 23rd, 2021. So I'd like to tell you a little bit more about some examples of the programs that fall under Goal 1. The first one is the Bunting Neighborhood Leadership Program. And for that program, we actually have a number of scholars that not scholars, actually leaders, community leaders, who we help to develop. And it's typically like a year-long program where we provide a series of leadership workshops and stipends to people so that they can take time away from their day jobs and spend some time focusing on developing leadership skills. The next thing we do is that we have a researchers resource newsletter that goes out on a bi-weekly basis or so that is co-sponsored by the Center for Health Equity. We are also developing best practice guidelines for community academic partnerships, and those will be made available on our website. So please look out for those. And we have a speakers bureau that is in development. So let's move on. So now we're going to move on to Goal 2. And again, Goal 2 is mobilizing resources in support of promising strategies to obtain substantial gains in health and well-being of Baltimore residents. For this goal, we actually support partnerships between academia and government. And so our strategic consultation grants for Baltimore City give faculty time to work in partnership with city government leaders on specific projects. And our next series of projects, strategic consultation grants, will be due on November 1st. So some of the examples of such programs include like providing evidence for the creation of healthy policies, as well as coordinating major citywide efforts to advance health equity. We've also collaborated with Johns Hopkins University's Office of Economic Development, as well as the Johns Hopkins Bloomberg School of Public Health on its Innovation Fund for Community Safety. And we've also supported violence prevention citywide policies. So I'll give you an example of some of the strategic consultation grants we funded. One of them is called Dirt Beneath Our Feet, assessing the soil health on urban vacant lots. This is a partnership between Baltimore City Department of Housing and Community Development and a research professor in the Department of Earth and Planetary Sciences at Johns Hopkins Krieger School of Arts and Sciences. So we have another such grant that actually supported a partnership between the Transportation and Safety Office at the city and researchers in the Bloomberg School of Public Health who were looking at how the city could develop a policy to assure that there would be equity in access to new transportation options, such as the scooters that we've seen available throughout the city. So we try to support these projects that will actually help to advance policies and advance the science of the policies to provide information to policymakers and decision making. So for Goal 3, which is next, we promote dialogue, understanding, and trust to create pathways to health, well-being, and social justice in Baltimore. Some of our upcoming dates are that we give out a Henrietta Lacks Memorial Award, which actually recognizes strong community academic partnerships. The next application will be due on October 4th, so the next series of nominations. We established this award in 2011 to honor Henrietta Lacks, whose cells helped to make possible the groundbreaking advances in medical research. And so we do this to recognize and support and promote exceptional community-based programs. It's a $15,000 award that highlights the importance of community academic partnerships. And then we present this monetary award to the community partner in the collaboration at the annual Henrietta Lacks Symposium. So another example of programs under Goal 3 is the Social Determinants of Health Symposium, which we hold on an annual basis. It's co-sponsored by the Office of the Provost, and our next symposium is scheduled for May 2022. A final example of this work is our Community Voices series, where we profile community members who are doing exemplary work in the area of health equity within their community. And we profile these folks on our website so you can hear about the stories of people who are doing things on the ground to make a difference. So I think I'm going to stop there, and I'll be happy to take questions when we get to that part. Make sure to stay connected with us through our Facebook page, our Twitter account, our website, and on Instagram. Thank you.
Thank you, Dr. Cooper. And next, we're excited to hear from Dr. Panagis Galiasatos, who is an assistant professor and co-director of Medicine for the Greater Good.
What an honor to go right after Dr. Cooper, a true honor. So thank you all for being here. And I will take 5 minutes of your time to kind of introduce to you a community engagement initiative that began over the Hopkins Bayview campus with the true intention of teaching people the sophisticated science that goes behind how to implement effective community engagement. I think when we go out into the community, we want to put our best foot forward. And from our standpoint, we want to make sure that people have the tools that they need in order to disseminate public health information in an ideal way. So let's go over a little bit more of what MGG is. So next slide. So we're out of the bat, we have to kind of put this under our focus of we're here to serve the community, right? That's what's key here. And so understanding what community health is, it's something that the community defines. This is highly important because when we go out there, we may go out there with recognizing what diseases are, et cetera, with our own pop health strategies, but none of that matters unless the community identifies what community health means to them. And this can be broad. It can be things from jobs to identity to culture and so forth. And from that standpoint, one of the things that MGG just emphasized is being one with the community, not being a doctor going into the community, but being a community member that happens to be a doctor. So part of the strategy is really identifying from a variety of communities that we work with, what are their health goals? Next slide. And I will say this, we do try to align potentially some pop health strategies with this. And if you end up wanting to work with us in some capacity, you'll see that we do that. One of my favorite examples is going out into Southern Baptist, a congregation a little bit north of Hopkins Hospital with Reverend Hickman, he's now Bishop Hickman, where I remember sitting in a meeting with him and he's like, jobs, our congregation wants jobs. And we actually implemented flu vaccinations because what we said to the congregation, and we cited the evidence, was flu vaccines help people not miss a day of work, help kids not miss a day of school. And that just meant you were able to show up to your jobs and so forth. So we aligned some strategies with pop health to community health, and that was huge. So that's one of the key things that we do when we go out to the community and message with them. So I'm getting your attention, because at the end of all of this, what we advocate for is public health outcomes, right? Take those moments of community engagement and truly make them into movements. Some ideal things that we're doing in regards to other disease states, for instance, is battling tobacco. Tobacco dependence, and tobacco is still one of the #1, I think it is still the #1 preventable cause of death in Baltimore, more than opioids and gun violence combined. So we always try to take these community efforts and try to transition them into movements, working with our city council members and so forth. Next slide. So in a time of crisis, we still have to recognize we're still in the pandemic, and some of our work may still be centered around COVID-19. We've launched in collaboration with a variety of other colleagues here at Hopkins, from the Office of Diversity, Inclusion, Health Equity to SOURCE, launching a variety of COVID-related initiatives. And one of them, of course, is actually getting into the schools to teach the students how to be their own advocates to helping end this pandemic. Next slide. So our primary goal, all of this said, and you're like, well, what do you guys do? Like, it sounds amazing. Hopefully your enthusiasms have been being contained to some extent. But one of our biggest outcomes is actually creating peer-to-peer educators out there in the community, taking them, informing them, and allowing the process of transitivity, which is kind of like networking, one message passes on to the other, to grow in an exponential fashion of public health dissemination. That's key here. So working with us, you'll partner with us, you'll collaborate with us in this kind of project. And there's a variety of them. One is happening right now, but we launch a variety of them throughout the city, depending on the communities that we're working with. Next slide. And then finally, the big takeaway as well is we do try to make everyone who works with us understand the significance of community engagement. right? To me, it is a necessity now more than ever to bridge community health and population health together. And if you do community engagement successfully, suddenly the hospital is not this entity that just kind of sits off to the side and no one goes to, but it's viewed truly as a key player in the community. And that's key. So teaching the next generation of healthcare professionals how to do this in a sophisticated manner is going to be vital to your own professional identity moving forward. So those are the big outcomes that we hope to achieve. Next slide. And as I said earlier, a few key projects you'll be able to work on us with. One is our peer-to-peer educator group that we launched in the public housing sectors here in Baltimore City. Before the pandemic, we were in 8 public housing units from west side to east side, north side, and to south side. And it was great. It was one of the most moving things that we've done. Actually, one of the tenants, a heartwarming story that they wrote for one of their newsletters was through the education, they ended up getting a job and actually graduating out of public housing. It was amazing. And then the other part, right, if you're also inclined to help us out with some database creation, this is a key one, especially working in conjunction with the Office of Diversity, Inclusion, and Health Equity, putting together a health equity resource, and happy to talk more about that. So boots on the ground to behind the computer to behind the scenes, we have plenty of work with you, but at the end of the day, we're here to promote your career, your professional identity, and on a side note, mentorship as well. That's another key thing that we do with all of our recruits. So thank you guys so much for this opportunity. Trying to contain all the enthusiasm in 5 minutes.
Well, thank you so much, Dr. Galia Santos. I think that you definitely drummed up some enthusiasm, and it's great to hear about the work of Medicine for the Greater Good. Our next presenter is Mindy Levin, our presenter from SOURCE. Mindy is the founder and director of JHU SOURCE, the Community Engagement and Service Learning Center.
Thanks so much, Kelly. Appreciate it. I'm really glad to be here today with a wonderful list of panelists. Many of us work very closely together. You'll hear me mention some things that I do in collaboration with Dr. G as well. So I'm really thrilled to represent SOURCE. Natalie, if you can go to the next slide, please. The work that we do at SOURCE is to engage all 3 of our Hopkins health professional schools and Baltimore communities in mutually beneficial partnerships that promote health and social justice. And all of the work that we do is guided by our core values, which I've posted for you here, which include reciprocity, justice, service, and collaboration. Next slide. Our team at SOURCE is small but mighty, as we like to say. As Kelly's already mentioned, I'm Mindy Levin. I'm the founder and director of SOURCE. We also have our associate director, Dr. Tyler Dareth, our assistant director, Delegate Tony Bridges. We're currently hiring for our next assistant director position as well. Vanessa Pinkney is our administrative coordinator. Ezat Shahade is our communications specialist. And Mr. Glenn Ross is our community consultant. For those of you that are students that are eligible for federal work study, we also hire a number of federal work study student program assistants each year. I think we have just about 2 work study positions still available. SOURCE is also governed by a governing board and our SOURCE Community Council. So as we mentioned, we serve all 3 of Hopkins health professional schools. So we have deans, faculty, and staff and students from all 3 of those schools that support us. And I've just listed here the deans that we report to at the 3 health professional schools. And Dr. Hahn, you'll be hearing from as well from the School of Nursing. Next slide, please. So the main focus of SOURCE is to encourage our Hopkins health professional schools to collaborate with Baltimore community-based organizations and public health organizations in our own backyard. We're still pretty proud that just 2 years ago, we were the winner of the Association of Schools and Programs of Public Health, the Harrison C. Spencer Award for Community Service. That's the only school-wide award that the association gives out. So we're really vested in our community engagement works here in Baltimore. So in terms of health equity research training opportunities, it's probably very, very similar to what you heard from Dr. G. From the UHI team, they've asked us to describe what are the content areas, methods, training opportunities, et cetera, that we have available. And my main message that I want to share with you is that it really depends. It depends on the opportunities that our community partners identify, because we work to respond to the opportunities that our Baltimore partners share with us. So our content areas are everything under the sun within our network of organizations. That same is true for methods, the multiple ways that we have trainee opportunities, and we do have both paid and unpaid opportunities. The folks that we work with, particularly here at Hopkins, we work with medical students, particularly those that are MD candidates in years 1 through 4, and then all grad students at public health and nursing, as well as all faculty and staff at public health and nursing as well. Next slide, please. In terms of some of the research projects that we have going on right now, we have a number of programs, and I'll tell you about these, but we are working to measure the outcomes of a particular service learning training program that we offer to faculty and community partners. And we also are working to measure the outcomes of the service learning courses that we've implemented at our health professional schools by our students and our community organizations that are participants. Another project that we've been working on, and this actually was a project that started pre-COVID, was that we had been working to develop a framework for online service learning courses. And those are some publications that are coming forward in the near future. A couple of us were involved in that opportunity. And then as Dr. Cooper mentioned, there's the Innovation Fund for Community Safety, and SOURCE is really honored to be a partner with one of our SOURCE partners, which is Good Harvest, on an occupational skills training program that we are just launching through the Innovation Fund. Next slide, please. So I've mentioned this concept or this pedagogy of service learning a few times, and I don't know if everybody really understands truly what service learning is. And at SOURCE, we tend to use the definition that's been shared by Community Campus Partnerships for Health, and that is really to say that service learning is a very structured experience that combines what you might typically think about as community service with preparation before we do that work, as well as critical reflection. And when our learners are involved with the service learning experience, they're doing so in response to community identified concerns. And we are really making sure that they have this understanding and knowledge about the context in which they're serving. So we do our best to certainly link what you're learning about in your academic coursework to what you're experiencing with our community partners out in the field. We do this oftentimes through one of our special programs that's called our SOURCE Service Learning Academy. This is a special year-long, extremely comprehensive program that we train faculty and community leaders together to give them the necessary tools to basically develop critical service learning partnerships, courses, and projects at a community partner site. So all the folks that are involved with our Service Learning Academy are able to become better teachers and preceptors. They learn to work equitably across academic and community partnerships. We're advancing the mission of higher education, and we're certainly doing a lot to engage on issues of justice and redefining the purpose of the work that we're doing in health, education, and science. You'll see here the leadership team includes some of us from SOURCE. You'll see a familiar face here in Dr. Bauer. We also have from the School of Nursing, Dr. Alexander, from Public Health, Dr. Frateroli, and two of our community leads, which are Alex Warwick Adams from Elevate and Pambora Brown, who is from Baltimore Medical System. Through our Service Learning Academy over the years, we are currently in the 10th year of that program. We have introduced and implemented a wide range of academic service learning courses across our 3 health professional schools. I don't have time to tell you about all of them, so I'm just sharing a few of those examples here for you on the screen, whether that is focusing on a particular skill set, like teaching our students qualitative research skills, and then they actually have an opportunity to work in partnership with another organization here in Baltimore to implement a qualitative research project and have that real world experience. We have courses in applications and program monitoring and evaluation. We have methods courses and topics-based courses. And the list continues to grow each year as we train more and more faculty within our health professional schools. At SOURCE, we also have a wide range of community engagement opportunities. The opportunities range from one-time, short-term to ongoing. A lot of what we do for the 3 health professional schools is that we help to line up internships, practicum, capstones, field placements, scholarly concentrations, whatever you call it. Oftentimes, these are academically based engagement opportunities that they're working with our Baltimore partners. We are building opportunities for public health practice here in Baltimore. We work with our student groups in the 3 schools to introduce them to Baltimore. And then what you'll see here is a number of our special programs. Some of the deadlines have actually already even passed for this academic year because we've worked to recruit for students and make those placements early so that we can really benefit from a longitudinal experience with our community organizations. So we have our longitudinal source service scholars program for the 3 health professional schools. We do our Baltimore action projects in partnership with the Bloomberg American Health Initiative and the participating organizations. One of our special programs is the Connection Community Consultants Program. This has been around for about 16 years. We put together small teams of students from across the 3 health professional schools to work on short-term projects that have been identified by our community partners. You heard Dr. G mention the work that we're doing to teach youth about COVID-19, and that is through a university and health system-wide partnership called Johns Hopkins HEAT Corps, it's Health Education and Training Corps. We also sponsor in partnership with Dr. Janice Bowie over at Health Behavior and Society in the School of Public Health, a certificate in community-based public health. We do a tremendous amount of programming around social justice. And we also have a set of online modules that are meant to help prepare folks to do partnership with community organizations that are available on our website. Next slide. Now, I mentioned that we have a wide range of partnering community-based organizations. In fact, we serve over 100 community-based organizations here in Baltimore. Whether there's a particular health topic that you're interested in or a particular population that you might be interested in serving, I encourage folks to take a look at our website and you can visit our online directory of all of our partnering organizations here in Baltimore. And then I also want to be sure that I point out some of the opportunities that we specifically offer to community-based organizations. So for one, there is an opportunity for organizations that might not already be source partners to apply to become a source community partner. And we have the full details about what that looks like, what that process is. We do accept applications about 3 times per year, and our next application deadline is November 1st. We also have a source community council. So that network of about 100 community-based organizations that work with Source, we have a council of about 15 representatives that serve with us for 3-year terms, and we really work to do a great deal of work together, and they help to guide our direction. I've mentioned our Service Learning Academy. That's a great way for community partners to be more vested in and learn more about service learning. We also offer some community preceptor trainings, particularly if they're going to be mentoring and working with our students. We also, within our team, we have dedicated source liaisons for each of our community organizations. So they have someone that they can always turn to with questions or when they need support. And then we offer a number of different capacity building opportunities for our partners throughout the year. Next slide. And then lastly, I'll share how can you become involved with Source. One thing that you could do is very easy, which is to subscribe to our Source Weekly Service Scoop. All you need to do is send an email to source@jhu.edu and type subscribe. Just let us know which school you're affiliated with and whether you're student, faculty, or staff. All of this information is readily available on our website, and you can certainly email us at source@jhu.edu, and our handle online on all social media platforms is @jhu source. So really happy to be representing the Source team and be of service to our health professional schools and to our fantastic network of community-based organizations here in Baltimore. And I hope you'll participate. Thanks all.
Great. Thank you so much, Ms. Levin. Appreciate all that great information about Source. Next, we have Dr. Hara Hahn, who is a professor and associate dean for community programs and initiatives at the Johns Hopkins School of Nursing. And welcome.
Thank you so much for the opportunity. Like Mindy said earlier, many of us actually collaborate together on a variety of occasions. I'm really happy to be here to present the community programs run by the School of Nursing. So our mission is to promote the health and wellness actually of people in Maryland through our main catchment area. Even though our main catchment area is in East Baltimore, we do faculty and student involvement in nurse-led community care, service learning, research, scholarship, and advocacy. Our values as highlighted are really wonderful: diversity, integrity, accountability, respect, and excellence. Our programs touch these topical areas addressing social determinants of health, mental health, chronic care, and wellness overall. Again, targeting residents in Maryland, underserved populations. Next slide, please. Thank you. So I've been in this role just for about over 2 months, following Dr. Phyllis Sharps, who retired from the position. And our community programs have been in place since 1994. I learned about that while preparing for this presentation. Our team have been doing amazing work, and their faces and names are highlighted here. We have Dr. Vincia Pandian and Lucine Francis, Doctors Lucine Francis, Patty Wilson, Laura Lucas, and Catherine Lin, all faculty liaisons across different sites, and also Anushka and Laquila as our staff. Next slide, please. Our current specific areas address social determinants of health, mental health, high blood pressure, diabetes, healthy eating, and health literacy. Through all these health behaviors and communications, we do qualitative, quantitative evaluations and research. We also do community and stakeholder engagement. We also run some of the controlled trials. There are ample training opportunities in terms of data collection, analyzing some of the data that have been collected. We just had this discussion this morning to compile all the amazing data sets that have been accumulated over the past 10 years. So you can imagine the kind of opportunities you can think about in terms of getting involved in some of these activities. There are obviously opportunities to write research publications. We also offer one-on-one mentoring. If there are any people who are interested in doing some of the shadowing, we do a lot of flu clinics and then other health education clinics. So you can shadow some of our community nurses, faculty, and nursing students as well. We have both paid and unpaid positions available. And we have been working with graduate students and postdoctoral fellows as well. Next slide, please. So this is a community impact slide based upon data that we pulled from the past 5 years. You can see that from the top, our physical locations through these different programs are at Henderson Hopkins School, which is just about 5-6 blocks away from the university. And then we have on 901 North Broadway, Lillian Wald Community Nursing Center. And this center has been utilized for many different purposes, including patient education and research-specific data collection. And then we have collaborated with Day at the Market at the Northeast Market. Now we're trying to expand our catchment to include other markets around the city. And as Mindy mentioned, we've been collaborating with SOURCE for the last several years through this program called Community Outreach Program. And through this program, so far over 200 students worked with a variety of community agencies for a total of 5,461 hours, which is amazing. And then Birth Companions is also another exciting program through collaborations with a variety of community organizations and health systems. We train students to go through this doula program. Doula is a support person to provide guidance and support for women and children during the pregnancy period. And so far, over 600 births have been attended, and our birth companion fellows have attended, or companions, the number of companions who have been educated through this program is over 300 as well. And then finally, but not the least, we have our physical space in House of Ruth, Maryland, which is a setting targeting for women and children in transition. And so far, we've encountered over 700 women and children, providing them with a mental health specific wraparound services. Next slide, please. So I highlighted some of the examples of ongoing research projects. I just didn't have a chance to list them all because there was a limited time, but these are some of the ongoing or in planning projects that you see. From the top, Passport to Freedom, led by Dr. Patty Wilson, focusing on women and children, again, in transitional housing. This is an intervention trial to deliver and test a model of mindfulness and stress management in the target population. We are in the process of regrouping with all the transitions and all. So now is a good time for you to reach out. And then project number 2 is called Ask a Nurse at the Waltz Center, led by Dr. Catherine Ling, who is a family nurse practitioner. We're targeting adults 18 plus with limited access to care to provide all around case management program while addressing social determinants of health. And then thirdly, the project Birth Companions, led by Dr. Laura Lucas, again, targeting pregnant women. We get referrals from International Rescue Committee, Family League, and then Baltimore Medical System. For this, our catchment area actually goes expanding the Baltimore City area to involve DC as well. Next slide, please. Can you go? Yeah, thank you. So again, our partnering community-based organizations are highlighted here. Service learning for the last few years, including last year, we have offered community flu vaccine clinics. And this year we are offering it again in October. And we are in the process of setting up dates to offer flu vaccine clinics over at the Henderson Hopkins School. And then also our community ethnic church, Isaiah Baptist Church, going back there to provide these vaccine clinics. Desired skill sets, you can actually take a look at that. And then other opportunities for community members. We are trying to create this stakeholder advisory panel so that we develop and implement services that are really relevant to our community residents. So there is that opportunity that is very clear for our community members as well. Next slide, please. Community outreach projects already mentioned. I would say anyone with passion for community health equity, community outreach with professionalism are welcome, because we have all the capacity and have been working with a variety of students from schools of public health medicine, as well as our own nursing students in collaboration with our community partners. So for those of you, next slide, thank you, who are interested, please feel free to reach out. You can find the information from our website, which has been copied across all these slides that I used. And we have administrative coordinator, Laquala. We are in the process of identifying the center manager at this moment. That is very close to its final stage, but we will have more community-facing dissemination endeavors once we have all the team built. But for now, if you have any urgent questions, please feel free to reach out to our administrative coordinator. And then depending on, we will triage and then identify relevant people to respond. Thank you so much.
Thank you so much, Dr. Han, and for all that great information. We'll have one more presenter and then we'll take a pause for some questions and answers. I see there are some already, so that's great. Our next presenter is Dr. Beth Resnick. She's the Associate Dean for Public Health Practice and Director of the MSPH in Health Policy. She'll be presenting about the Office of Public Health Practice and Training.
Thanks, Kelly. Yeah, I'm going to just be real quick, and my presentation is less about the Office of Public Health Practice activities that we have, but more just about to help people navigate. There's so much going on, lots of things, so how to find things and figure out what's going on at the School of Public Health. So next slide, please. So I just wanted to highlight, and we're going to post these slides in the chat, but I just wanted to help people sort of figure out, how do I find stuff with all, I'm hearing about all these opportunities. So hopefully most of these opportunities you've been hearing about will be listed. The practice office, we host a School of Public Health student jobs and opportunities inventory site, which is, the links are all here. And like I said, we're going to post them in the chat. There's also the specific federal work study positions. There's also a Johns Hopkins University SMILE, which is opportunities across the whole university. They tend to be more focused on undergrad, but they do sometimes have things in there that are posted as well. So you might want to check there. Then we have career services in the Bloomberg School that all has jobs and sometimes also has some part-time opportunities. And they have their handshake platform, which I would encourage you guys all to get used to, because as you start looking for full-time jobs when you graduate, that's a great thing to be used to. Next slide, please. So also, where do you find information? Again, this is School of Public Health, but I really encourage you guys to use the speed read, and for faculty on here to post your things in the speed read, because it makes it so much more efficient for everybody to get those Tuesday, Thursday newsletters. There's archives of the speed read, which this is all posted here so you can access. There's the events calendar, and then the super important thing, obviously you guys are here today, but the ones that aren't, there's an event recording archive. And again, I really encourage all of the faculty on here to make sure that you're using these tools so to help us all stay coordinated and organized. Lastly, I know it's midterm week, it's stressful. So next slide, please. I wanted to just highlight, oh, sorry, one more slide. You could also look at the centers websites and look and see what different centers are doing. But anyway, I just wanted to highlight mental health resources that are super important. And again, we'll put these in the chat, but there's lots of resources and they're available for all of us and we should all be using them if we need them. There's virtual resources as well as on campus resources. And I actually have a separate slide with specific information on both the virtual and the on-campus resources that I'm going to post in the chat as well. So that's it. Hopefully we can take a little break. Thank you guys. Welcome to our community and look forward to working with you all and happy to share other information if people want to email me about our projects or programs. Thanks so much.
Great. Thank you so much, Dr. Resnick. That's wonderful information. So we are going to take a pause and do some questions and answers for the first 5 presenters. And there are some already. Again, we're taking questions in the Q&A box. So if you're able to put them there, that is helpful. There are a couple of questions about resources from the Urban Health Institute. One is a question about whether the Baltimore Impact Grants are limited to community-based organizations in Baltimore, or if they can be awarded to organizations outside the US. I think, Dr. Cooper, I can answer that. Those Baltimore Impact Grants are really specifically for university community partnerships that are happening here in Baltimore City. So the community-based organizations need to be located in Baltimore City. There's also a question about the upcoming grant writing workshop that's being sponsored by the Urban Health Institute in October, and a question about getting a link for that registration. So I'll ask Natalie or Emily to post that information about the grant writing workshop. There's also a question, several questions about, are there opportunities for international students or staff or graduates to be involved in the work of any of these centers? So I would invite any of our previous panelists or even upcoming panelists to respond to that question.
Well, this is Dr. Cooper. I will say that that certainly that is an option, especially if you're a student here at the school. That there's no reason that you wouldn't be welcome to participate, in the activities that are there. A lot of this I think if you're thinking about trying to get a paid position, then I think it's about whether you have permission to work in the US. And I think as a student, you might have the ability to work on campus, but not at other places. But I don't want to speak on behalf of all the centers, but I will just say on behalf of UHI and also from the Center for Health Equity, Dr. Cruz will be talking more about that we do welcome international students.
Great. Any of our
And then on behalf of Source, we also have opportunities for international students to be participating in our programs. If you're here in Baltimore, there's more opportunities to be engaged with our Baltimore partners. If you are a distance-based student, we still have opportunities for you to engage with our Baltimore partners. However, oftentimes our caveat will be, we encourage you, if you want to participate, that you need to have some ability to participate with our partners during Baltimore business hours, because we don't put that added burden on our community partners to meet with folks on those off hours during their personal time. And with a number of our service learning courses that are online, that gives the opportunity for students that are not physically here in Baltimore or the greater Baltimore region to be participating, and sometimes that's in small groups with our nonprofit partners. So definitely lots of ways that we encourage and welcome our international students to engage.
I want to say same here for the programs offered at the School of Nursing. Anyone, again, like I highlighted at the end of my presentation, who is passionate for community health, health equity, there is room for any possible project. So go ahead and let us know.
Great. And Dr. Han, there's another question here about how to participate in the Birth Companions program specifically.
Thank you. So for now, the program has been mainly open to nursing students. There is an elective offered through the School of Nursing for you to be able to work as part of the Birth Companion program fellow. You first have to go through that course and then be certified as a doula. And then you will be able to work with women who are in need. However, at this point, I can say Dr. Laura Lucas is in the process of expanding the program to make it truly interprofessional, to include and engage students from different schools. So keep us posted. Let us post the further information.
That's great. And the Urban Health Institute will be happy to help distribute that as that evolves.
Thanks so much.
Thank you. Great, and I did see a few more questions in the chat, and I did see thank you to the panelists who responded to those questions there. All right, so I think we will move on to our next set of presenters, the first of whom is Dr. Deidre Cruz, who is the Deputy Director of the Johns Hopkins Center for Health Equity and Professor of Medicine. Dr. Cruz.
Thank you very much, Dr. Bauer. Really excited to be with you all today. I'm hoping, I guess my slides will pop up here in a moment. Okay. Thank you. Thank you, Natalie. So happy to share a bit about the Johns Hopkins Center for Health Equity. So our mission at the center is to promote health equity for socially at-risk populations. Through advancing scientific knowledge through the research that we conduct at the center. A very central part of our work is around educating and training leaders. And so really happy to be here today to talk about training opportunities. And then a third really key component of our work is around partnering with communities. And that work involves raising public awareness of health inequities and also promoting sustainable changes in both practice and policy. Next slide. We are fortunate to have a sizable group of committed leaders as a part of our center that help us to I think conduct the work that we have ongoing. Led by Dr. Cooper as our center director and myself as deputy director. Ms. Malello, who you have met, who is our program director, and then Mrs. Katie Dietz, who's our senior research program manager. And then we have a host of administrative coordinators, our communications coordinator, research assistants, and senior research program manager as part of our team. And then we have 3 cores that are led by faculty, including our methods and shared resources core, led by Ms. Kit Carson, our policy core led by Dr. Rachel Thornton, and our community and stakeholder engagement core led by Dr. Chidima Ibe. Next slide. At our center, as I mentioned, given our major focus on community engaged research, we have ongoing right now several research projects. Some of them are highlighted here. And each of these really does involve engagement with our community partners, our community advisory board. The first project I'd like to highlight is our Rich Life project, which is testing the effectiveness of collaborative care, really through partnership with community health workers. And it also involves provision of access to remote specialist consultation. We have the 5+ Nuts and Beans for Kidneys trial, which I lead with Dr. Pete Miller, which is a dietary intervention study focused on addressing the needs of people who have low incomes and may be facing challenges with respect to food access. And then we have the Adinkra study, which is based in Ghana, led by Dr. Yvonne Commodore-Mensah. And it is testing shifting tasks of care from physicians to community health nurses, here addressing disparities in hypertension control. And I'll highlight here in a moment some of our training opportunities, which of course is what we're focusing on here today. Next slide. So we love celebrating the accomplishments of trainees that have come through our center since its inception in 2010, including that we've now trained over 150 scholars, myself included. You'll see my face there in the slide. We celebrate the accomplishments of our trainees, including multiple career development and other research grants, numerous awards, publications, faculty appointments, as well as graduations, all the way from the high school level on up through graduate programs that our trainees have completed. Our training in health equity includes training around, sorry, one slide back if you wouldn't mind, training around designing research interventions, community engagement, and also really developing skills around translating policy into clinical practice. Next slide. And so we do have a number of different training offerings. We have monthly seminars called Health Equity Jam Sessions. We have courses that are offered through the School of Public Health, both in the 3rd and 4th term. We have a Coursera course that is open globally, and that course is called Foundations of Health Equity Research. We, through these courses, again, offer training around engaging with multiple stakeholders, the students who complete these certainly gain skills that then will allow them to publish that work, and in many cases, including in scientific manuscripts. Next slide. So this is just to highlight the Coursera course, the free online health equity courses that we offer. And you'll see the kind of the links for those. Just to highlight here, the patient and community stakeholder engagement that we have ongoing. We have a wonderful and very large community advisory board that holds quarterly meetings. And here, this is really where we conduct a lot of our research work in partnership with our CAB members, including the design and implementation of our research studies, as well as the dissemination towards sustaining the work that we've conducted through research. We also, in this work, in these meetings, we are able to make referrals and review kind of job descriptions for some of the opportunities we have to actually hire some of our community advisory board members or their contacts through their organizations, including hiring community health workers kind of out of our community partnerships that we have ongoing. And then we, of course, review the work and discuss the relevance of the research work that is ongoing at the center. Next slide. So as I mentioned, we have the Health Equity Jam sessions. I'm highlighting here on the right our upcoming session on October 27th. As well as some highlights of some of the special symposia that we have ongoing, as well as our newsletter, Health Equity Happenings, that we would certainly invite you all to receive, that comes out regularly. Next slide. I'll end here. These are our contacts, so feel free to follow us on Twitter and check out our website. Thanks.
Great. Thank you so much, Dr. Cruz. Our next presenter is Dr. Jean Clark, the Executive Director of the Johns Hopkins Brancati Center for the Advancement of Community Care. Dr. Clark.
Great. Good afternoon, everyone. I hope you're all still hanging in here after more than an hour, but I am excited to share what we're doing in our center and really honored to be part of this panel. So the mission of the Brancati Center is to improve the health of communities locally and nationally by developing, evaluating, and disseminating new models of healthcare that leverage the skills of a diverse range of healthcare providers. So our overarching approach is to provide, on the one hand, clinical programs that are health-focused, evidence-based, outcomes-driven, and sustainable, And if they don't exist, we look to develop those programs or build the evidence. And then we also provide educational programs that either address our community needs or enhance training for diverse groups pursuing careers in healthcare. So that is pre-graduate school, pre-university. We partner with Merit Health Leadership Academy, for example. And then we look to enrich the training in community and population health for current healthcare trainees in any school. Next, there should be. Our primary area of focus or target populations really has been either low income or otherwise disadvantaged and African-American population in Baltimore to start. Next slide. I, really have the fortune to lead a strong group of faculty, including Dr. Gitanjali Chander, who directs our community-based research. Tangela Purnell has joined us as our education director. Nisa Maruther is director of our community program implementation, and Maya Venkataramani is on with our core faculty. We have 10 associate faculty. I didn't have time or describe. Again, all of this will be on our website. But we are supported by, oops, sorry, go back please, a fabulous staff, which I won't name everyone, but I do want to call out a couple of people. Megan Brown, who's the program director, and she'll be the main contact for the center, as well as a number of interventionists and program coordinators, as well as community health workers who round out our team. Go ahead now. So what are the training opportunities within the Brancati Center? Like other centers, we are across a variety of content areas related to metabolic disease like prediabetes, diabetes, obesity. We work in kidney disease, but also substance use disorders, including tobacco use, HIV prevention, and social determinants of health. We use a variety of methods that are appropriate to whatever the project is we're doing. And then, like others, we have opportunities for collecting data, analyzing quantitative or qualitative data, writing up findings, and then we do a lot of one-on-one mentoring and career development. We have both paid and unpaid positions, and really we can take people from all levels, including, as I mentioned, we're working with high school students. Next slide. So here are a number of our ongoing research projects. The Sharp Women Project, which is working to address unhealthy alcohol use across the HIV prevention and care continuum. Gitanjali Chander is leading that. It's really focused on women living in Baltimore, and it's a mixed methods project. There's a pilot randomized trial of an avatar that is a computer-generated figure. This happens to be a raven, so C Raven is the name of it, to deliver smoking cessation interventions for low-income smokers. Right now, we're focused on a hospitalized population and trying to figure out how that can help lessen tobacco use and enhance cessation. The FEED study, this is in partnership actually with the Movable Feast, one of our community partners, and we're looking at the impact of medically tailored meals, which are prepared and delivered by Movable Feast, on the healthcare outcomes and costs among people living with diabetes. This is focused on adults with diabetes in Baltimore City. We're also partnering with Priority Partners, which is a Medicaid provider. So that's a kind of neat ongoing study. Next. We have a large footprint in sort of diabetes prevention area. The DPP implementation is led by Dr. Nisa Maruther. This is focused broadly on adults living in Baltimore City. And as we use the CDC National Diabetes Curriculum, Diabetes Prevention Curriculum, we're a certified provider. And this was recently given a big boost by a nearly $43 million contract with the Health Services Research Commission. And so we will be scaling this up quite largely. There are two projects. One is listed here that feed on that or build out from that. Dr. Maya Venkataramani is leading a development of a family-oriented diabetes prevention program, which looks to really enhance what we already know to be some spillover effect for children and families of people who undergo or are going through the DPP program. And so this will develop that out, pilot test that, and hopefully we'll implement that. And then another, and she's supported by a K award. We have another faculty member on a K or Career Development Award who is looking to augment the DPP with cooking demonstrations. And so these are ways we've had junior faculty working with us. Lastly, last thing, if you can go back, thank you, has to do with one of our educational projects. And this is in collaboration with many on this call, including the Center for Health Equity, Medicine for the Greater Good, Center Soul, really to develop a longitudinal community engagement curriculum for residents at Johns Hopkins to address social determinants of health. And this has been across residencies in medicine, surgery, and pediatrics. So far, we're looking for other places to implement. Go ahead, next slide. So lots of community engagement opportunities. As I mentioned, we have many different partners across the city, many churches, Movable Feast I mentioned, American Heart Association. We've been in a couple of community centers and so forth. And then there are a number of service learning opportunities. We do community events. These have been fewer and far between during COVID, but we were involved in several vaccine events for COVID, and then doing the community-based programs, many virtual right now. We do hope to get back in person. What are we looking for? Like others, interest in and commitment to partnering with the community to improve health outcomes. And we do also have a community advisory board. If you're interested in any of our programs and having them brought to your location, to your church or community organization, especially DPP, we're looking to roll those out, but others, we're happy to partner with you. And we do run a volunteer corps if you'd like to sign up. Go ahead, please. Collaboration for non-trainees, we are really looking to achieve our mission, and that takes a lot of people. And so we're happy to collaborate. For anyone interested, please do reach out to Megan Brown or any of our center faculty. How to become involved? I've mentioned Megan's name a couple of times. You can email her directly or at brancati-center@jhmi.edu. We have our Brancati Center website there. And if you look at Get Involved on the website, that will allow you to sign up for the volunteer corps. So I hope we get to meet some of you in person soon. And thanks for the opportunity to present.
Thank you, Dr. Clark, for presenting all those exciting opportunities at the Brancati Center. Our next presenter is Monica Guerrero Vasquez, and she is the Executive Director of the Johns Hopkins Center for Salud, Health and Opportunity for Latinos, also called Centro Soul.
Thank you very much. What an honor to be here after all this amazing professionals. No sé si hay alguien que hable español, pero buenas tardes. Happy Hispanic Heritage, Happy Hispanic and Latinx Heritage Month. As you know, it runs from September 15th to October 15th. And I'm very happy to be here sharing some of the work that we do. Next slide. The root and the really inspiration for me to be part of Centro Soul has been the idea of the desarrollo humano, or the human development. And I just share the definition from the UN here. What really is deep into my heart is that human development is about giving people more freedom and opportunities to live lives that they value. So that is really the basis of the work that we do at Centro Soul. Next slide. Recently this year, you probably saw in the news the release of the census data, which I was waiting anxiously, because I really wanted to stop the comment of Latinos aren't really too many here in Baltimore, whereas we don't have capacity to serve all the needs that we have in our community. The graphic that you see is a representation of the increase in Baltimore City. The Latino population increased more than 50%, and about the same in Baltimore County. Overall in the state, more than 50% of Latinos, the population has increased more than 50%. So Have we increased our resources and capacity at the same pace of the population? That's a question that I'm going to pose here for everyone to think about. Next slide. So with that context, our work, our mission, our center is to promote equity in health and opportunities for Latinos. Next slide. And with the vision of achieving equity for all Baltimore residents, regardless of their origin or immigration status, our mission is to promote equity in health and opportunities for Latinos in collaboration with community organizations, public agencies, and really our position as a part of Johns Hopkins is very strategic to be able to connect with all those areas. Our core areas are focused on promoting clinical innovations. So I am in a corner in an office. We don't have a physical center where we can provide services, but the clinical innovations comes on identifying out in the community what the needs are and how can we be better, how can we better understand how to provide services. Most of the people that we work with are uninsurable. That means that with a prohibition from the Affordable Care Act, they cannot get insurance and they don't receive any benefit. So how can we use innovation to give them access to the resources that they need? We also work on advocating for diversifying the workforce and education. We need more bilingual and bicultural staff. There are studies that show that it's important to provide quality healthcare, but also quality public health. We also work promoting innovative research practices based on community participation, and we'll talk more about this in the next slide. And we are trying to build a more just policy and promote systems change. We have a work group that observes and monitors the quality of implementation of policies, and we work on giving recommendations or pilot programs at the clinic so that we can serve this community the way that they need and deserve. Next slide. So as I mentioned, the core of our work includes a strong community participation through advisory boards and language appropriate programs. And Dr. Galiachatos mentioned earlier, so what is community and how we can better serve them? With a lot of being very humble, we don't bring the solution to the community, but we talk to them and ask them what are the needs and how we can be better at addressing those needs. We have a Latino Family Advisory Board that provides advice across the spectrum for our programming and research, but also we have incorporated advisory boards in the different research studies that we work at the center. Next slide. The reason I wanted to pause with the mental health programming and research is because it has been shown for the past several years in our work that the trauma and PTSD and mental illnesses is prevalent in our community and very undertreated. So we have been working to address the stigma around mental health to support youth and adults on dealing with stress and depression. And we have been trying to find this innovations to address and treat depression in Baltimore City. We launched in May this year the campaign called Fortalece tu Bienestar. It's entirely in Spanish, and it was built. It's an evidence-based campaign that was driven from hundreds and hundreds of opinions and thoughts from the local community based on the resources that they have access to and the perceptions they have about mental illness. We have also worked with support groups. We are providing support groups as an entry point for individuals who don't have any type of mental health support and yet are facing many struggles. The support groups for adults called Testimonios and for teenagers called Teen Testimonios are conducted in Spanish, are culturally and linguistically appropriate, and are community centered. For the teens, we run summer camp that in addition to providing the tools and coping skills for the youth, provides also mentoring and a welcoming space. And the picture that you see here is very powerful because they were sharing their experience crossing the border and how they are feeling welcome here with their families, but still disconnected because they were left in their home countries when they were babies and they are encountering a new family that they have to adapt here. Next slide. So as I mentioned earlier, one of our core areas is the promoting diverse workforce and education. And we have been working with youth programming since our beginning. We have a youth program that includes summer programming and now a year-long mentoring and tutoring. The strength of our program is that it targets culturally appropriate approaches. So we're trying to serve immigrant origin Latinx youth with parents who, most of them don't have higher education or haven't finished high schools themselves. So we're trying to provide the resources and the path for the youth throughout the school year with mentoring and tutoring. And in the summer, we have established a collaboration with YouthWorks to be able to provide opportunities for youth who may not qualify to the YouthWorks program through the regular application process. In this slide, I just tried to summarize the COVID-19 response that has disproportionately impacted the Latinx community in the country, and particularly in our city. We have collaborated with the Mayor's Office of Immigrant and Multicultural Affairs to provide cash assistance for families who, as you know, did not receive any benefits or any relief benefits during the pandemic. We started with 30 families to help them get some groceries because they were positive with COVID and they were sick, and that multiplied and increased to more than, I have to update that number, to 3 sites, distribution sites in partnership with faith-based organizations in Southeast Baltimore and Southwest Baltimore. We have 3 food distribution sites that is supported by the Baltimore City Office of Planning and also donations and grants. And every week we have people who rely on the food that we provide. Something to note about the food access program that we have right now is that we have been trying to be mindful of culturally appropriate groceries. So it's more than just give people who are hungry any food and they will eat anything. That's not true. That's mistaken. People deserve quality food and deserve respect on what assistance they are receiving. So we have been able to build this network with multiple organizations, as I said, and faith-based organizations to provide food to families. We also are still running weekly informational workshops entirely in Spanish in collaboration with social media outlets and influencers here. And we started providing information about COVID and the vaccines, and we brought experts who will talk in a very lay language about the myths and answer questions from the audience. And now we have expanded that to answer really any questions for accessing services for the Latinx community here. And last but not least, we have been working on the vaccine distribution and outreach. We have community health workers that are out and about in the community talking to people every day about the vaccine. And finally, the last 2 slides are just to mention what are things that we need, as I mentioned, a network to address mental health needs of the Latinx community that is culturally and linguistically appropriate. We also would like to have a pool of bilingual and bicultural community health workers, and that has a lot of implications that I cannot expand here. And we all here need commitment from government agencies and philanthropy for funding these programs and collaborations with all the partners that we have here. I'm happy that I have collaborations with many of the presenters in this session. And what you can do, you can help us fundraise. We have a holiday drive open right now, and we're fundraising to support more than 200 families for the holidays. You can go to our website and find more information about it. Thank you very much.
Thank you, Ms. Vasquez, for all that wonderful information about Central Soul. And our final presenter I'm pleased to introduce is Ms. Cherie Wilson, who is the Program Director of the Johns Hopkins Medicine Office of Diversity, Inclusion, and Health Equity.
Great, good afternoon, everyone. And Natalie, I'm fine with advancing my slides if you'd like to share control. Thanks, great. And so great, everyone. So my presentation is going to be a little bit different because in our office, we don't really have training opportunities. We actually are charged with operationalizing diversity, inclusion, and health equity across the Johns Hopkins health system. So this involves all of our entities and the School of Medicine. But what we do is we largely put together a variety of different resources. And so I just wanted to highlight a few with the time that I have. So I'm just going to share a few, and in looking at the comments and the questions that are coming through, a lot of questions involved volunteer opportunities. So for those of you who are within Johns Hopkins, there was an email that was sent out about a week or two ago about Community Connections, which is a platform that I'll talk about in a second. I'll share some of the resources that we developed over the last year and a half in partnership with so many stakeholders. So like with Monica Guerrero Vasquez, Centro Sol, the Center for Health Equity, Source, and a variety of other partners. Again, I'm going to share these with you so that hopefully you can share them more broadly. And also to my one ask will be about assistance to assist our newly arrived Afghan refugees by people who actually have language skills in the requisite languages. So let me start with Community Connections. Basically, this is a portal that Johns Hopkins Medicine developed basically to answer that question about what can I do to help serve the community. So this is basically a one-stop shop. If you log in, and as everyone has mentioned previous to me, these slides will be available and these links are live. You'll be able to click directly here. You'll go to this portal, you'll log in with your JED ID if you're within Hopkins. You can update your profile. I actually went in and created my own profile, and there are so many different areas you can identify as your interests, where you would like to assist. And basically, this will be a way to be able to connect people with various opportunities in the community. So you have Mindy Levin, who talked about source opportunities, which are largely for our students and our trainees. But I saw someone ask, what about people in the health system? What about staff? And so this is a way for people across a variety of areas. So it's not just limited to one group. So I wanted to share that here. And then a huge thing that we were involved in was COVID vaccine equity. So actually even before that, let me take a step back. Basically, when the COVID pandemic hit, we looked at the communities that were disproportionately being affected, largely our Black, Latinx, and our Indigenous communities. And we were working with a variety of community partners, whether it was food pantries for the community and our own employees, whether it was providing personal protective equipment, whether it was working with these communities to ensure that people knew how and where to get tested. Then when the vaccine became available in December, we partnered with a variety of infectious disease faculty who happen to also be persons of color here at Hopkins, and my boss, Dr. Sharita Hill-Golden, who's our Vice President and Chief Diversity Officer, and they developed a COVID-19 vaccine equity playlist. So we created a flyer with the QR codes, but there's a whole playlist out on YouTube that can be shared, and it was to answer people's basic questions. So like the previous presenter, Monica Guerrero Vasquez mentioned, many people had questions like, will this cause me to be infertile if I'm pregnant? And we now know that, especially for pregnant women, they are even more susceptible if they become ill with COVID while they're pregnant. There were questions like that. Who was this tested on? What are the demographics of the people involved in clinical trials? Is this safe for me? What are the differences between the different vaccines? So those questions were answered. So these resource websites that are available, please, please, please share. So we have a website on equity for COVID-19 vaccines and care. We have one on vaccine equity information and videos. The playlist that I just mentioned, that is on YouTube. And also our partners in the ICTR, which is the Institute for Clinical and Translational Research. along with the CRAC, which is the Community Research Advisory Council, developed this wonderful SWAY website called Project Hope, which is Hopkins Opportunities for Participant Engagement, which provides great up-to-date news about COVID-19, vaccines, testing, the Delta variant in language that is accessible to many people. And many of these websites are accessible both in English as well as in Spanish. I also, in the interest of time, don't have time to share this video to show any part of it, but please, this is another thing that was created. This was a partnership between the Ad Council and the It's Up to You ad campaign. The reason why I highlight this is because you probably hear that a lot in the Black and African American communities, that people do not want to get the vaccine because of the legacy of the Tuskegee syphilis experiments or Henrietta Lacks or a variety of things. What is fascinating about this 5-minute long public service announcement is that you have descendants of people who were part of the Tuskegee syphilis study talking about that legacy, but then they share why they're getting the vaccine despite that. And so what they emphasize is, look, these men had syphilis and they were not given the penicillin they should have received to cure their syphilis. Now we have something to help us. Let's make sure that we take advantage of this vaccine. So it's really very powerful. So it's actually directly embedded in the slide, so you can share it, but also the link is at the bottom of the slide as well. In addition, if you go to these websites, Get Vaccine Answers, and then in Spanish, decidepende.org in Spanish, this will tell you about all the different communities that are targeted. Like Monica mentioned, these are culturally and linguistically appropriate messages that are hopefully being put forth by trusted messengers from the community. And then lastly, the request is that, again, with the recent influx of Afghan refugees, we have a huge need for interpreters who speak either Pashto, Dari, or Farsi. Farsi is understandable to people who speak Dari, and especially if someone has medical expertise, and especially women. So if anyone is interested, Dr. Kathleen Page, who is one of our infectious disease physicians, she's also involved with Centro Sol. Her email address is here, and if you'd like to volunteer in that capacity, we would greatly appreciate it. And with that, here's a link to our website. It has a variety of resources available for your use. And with that, the last thing I have then is, if you'd like to learn more about what we do and be kept abreast of all of our different events, our trainings, our educational opportunities, please sign up for our weekly newsletter. And with that, I will turn it back over to Kelly. And thank you so much.
Well, thank you, Ms. Wilson. That was really great to hear more about your office and its work. And thank you to all the presenters. It's really been, I think, exciting to see the diversity of populations being served, the health issues being addressed, and really the commonality of the community engaged approach and the centering the voice of community that our Johns Hopkins centers and offices are using in their work. So thank you to all of our presenters. We do have a minute maybe or two for questions and answers. We had thank you to our panelists who really made my job easier, because you've answered some of those questions right there in the chat. The one question that I think some of our panelists addressed already, but I'll just say out loud, is about volunteer opportunities for staff and graduate students. And Mindy Levin mentioned that in her post. I think Dr. Clark and Ms. Wilson mentioned that as well, but happy to have any of our panelists expand on opportunities for staff and graduates of the university to volunteer and participate in activities.
This is Jean Clark, particularly for our volunteer corps. We've had, we had faculty who left the institution, went around, but still live in Baltimore. They were helping us give out vaccines, and we need people with and without medical expertise. We need people to guide, people organize, sign things, just help out generally. And so all sorts of skill levels are welcome, medical and non-medical skills, really helpful to put the whole thing together.
Great, thank you, Dr. Clark. Anyone else?
I think I'll just mention, I think Kelly already verified this, but Source, we are a resource for faculty, staff, and students at our 3 health professional schools. The only caveat in there is at the School of Medicine, we're only funded to serve the MD candidates in years 1 through 4. So if you're a faculty or staff at nursing or public health, we serve you and provide community engagement opportunities in many different ways.
Great. Dr.
So
Cooper?
I'll just mention, I think depending on the time of the year and what events are going on, both UHI and the Center for Health Equity would be open to having volunteers, but for the most part, when we take trainees in, if they're getting involved in research, they have to be people who are already involved in the school, either as a student or in one of the clinical training programs. They do have to undergo human subjects research training and or be an employee. So if you're volunteering, it's usually for like a special initiative that's being launched. And so that generally, you could certainly reach out, but we would probably put out a request for volunteers for a specific event if we needed that.
Great, thank you for that distinction. All right. Well, I think that brings us to the end of our time. I just, again, want to thank our panelists and encourage all of our attendees to look at the contact information that's been provided in the chat for all of our panelists and organizations and the information provided on the slides. We will be posting these slides and the recording of the presentation to the UHI website. And we are just so grateful for everyone's time and attention and for being here with us today. I will pass it to Dr. Cooper for some final remarks and to close the event.
Certainly. So I just want to say thank you to all of the presenters and all the organizers of this event. We couldn't have done it without you. I continue to be amazed by all the amazing opportunities that are available here at Johns Hopkins. I learn something every time we do this. I learn about more opportunities. I hope this has been helpful to those of you who have been seeking these opportunities. And again, we just look forward to seeing you at our seminar series, during our activities, and also, just as we go about our work, research and training and teaching. Thank you for joining us.